So I'm just going to introduce today. This is the 20th anniversary event. You might have noticed that it's the 20th anniversary of myself. I'm 20 years working full-time in the Euthanasia Prevention Coalition, so it's a little bit different than a 20th anniversary in general, but I'm accepting the anniversary as it's mine to be shared with everyone. And today we have interesting presentations for you, so hopefully there'll be a lot of people getting information out of this, whether you're watching it now or in the future. I'm be presenting first, and my talk will be on the fatal flaws of euthanasia and assisted suicide. I'll be followed by Amy Hasbrook, our president. She's also the founder of Toujours Vivant, Not Dead Yet. And then there will be Taylor Hyatt, who's a researcher for Toujours Vivant, Not Dead Yet. And then we're going to have Maxime from Quebec, from the Vivre dans la Dignité, the Living with Dignity group in Quebec, talking about the different issues about all that's going on. And it'll be followed then by Christina Hodges, who will give you a little bit of information about the Compassionate Community Care Program. And finally with Catherine Glenn Foster talking about what's going on in the US and a bit of a message there. So my message is more general, and I will start with my PowerPoint presentation. And so what's going to happen here is that we have this recording going on, and the person controlling this will then shift to the PowerPoint here and there. You'll be able to see it. So, and in the future, if anybody wants, for instance, my PowerPoint, if you email me at info@epcc.ca, I can send it to you. That won't be a problem, as well as my other PowerPoints I have. So basically, euthanasia and assisted suicide, here's my first message to you, is it's sold to us and to the culture through what I call, and what we've called in our film, a series of fatal flaws or lies. We're told that euthanasia is about freedom, choice, and autonomy. This is simply not true. This is not what it's about. We're told that these people are dying anyway. So this whole thing is, well, you know, Alex, they're dying anyway. Well, many of these people might have years to live. So this is not true. We're told that these laws have effective safeguards. But if you read the laws aren't designed in that way. In fact, they have language which is undefined and loose. And in the Canadian law, especially, we have several parts of that. I say the language is loose enough to drive a hearse through it. That's the funny little joke. And we're told that the person must make a clear request, but this is not always true. Let me start, first of all, though, by talking about why people ask for euthanasia and assisted suicide. And I think this is a clear key issue to all of this for us. And that is because people go through what we would call normal human realities. So if you're considering euthanasia and assisted suicide, someone's considering this when they're going through the most difficult time of their life. They're going through a time of physical issues, maybe psychological issues. They are often going through depression or loneliness, fear of future pain. What's most important here, though, as a human being, there's nothing new about somebody feeling that their life has lost value, their life has lost purpose. There's nothing new about someone going through a very difficult time in their life, going through existential questioning, if that being what it is, or feeling like there's just simply no purpose to their life. You know, this is not a new experience as someone might think. I have fear for the future. I don't know how to get through this. I'm not sure. And why am I alive? I might want to, rather be dead. This is not a new feeling. This is a human reality when someone is going through an emotional distress. The difference when we legalize euthanasia and assisted suicide is the other side says, oh, it's about your choice and autonomy. Really what it's about is it's abandoning people at the lowest time of their life. What it is it's saying, in the past when someone would say, they felt that their life had lost purpose and value, or they wanted to die, the physician would then be thinking about, how do we provide the help this person needs? How do we provide the services they need in order to get over this hump that they're feeling? But now today, it becomes a request for death. So the difference between before and now is now when you're going through what I call a normal human reaction to these difficult times in life, what we have instead now is this becomes the request for euthanasia. And the whole point of it is that in every jurisdiction that's legalized euthanasia, it's done by the doctors gaining the right in law to cause your death. So if we're talking about assisted suicide, that's when the doctor would then prescribe the lethal drugs to you, and you would technically take it yourself. The physician is then agreeing that your life is not worth living. They're agreeing that your request for assisted death, lethal drugs, is reasonable in their sense, and that they wouldn't want to live like you either, and then they make the prescription. In the case of euthanasia, when it's lethal injection, you have a situation then where it's the doctor who's then agreeing your life is not worth living, and they go ahead and actually kill you. It's the actual act then of killing you. And those are the differences between assisted suicide and euthanasia. So what's sold to us as choice and freedom and autonomy is actually an abandonment of people at the lowest time of their life. This is what it's about, this is what it leads to, and this is where it goes. So, is euthanasia about freedom and autonomy? Well, you know, the recent Fatal Flaws film that EPC produced with DunnMedia that has done very well, has been shown all over the place, and if you haven't seen it yet, you need to see it, you need to purchase it. One of the main stories in the film is about Margret's mother, who died by euthanasia without request. Now, if we had more time today and everything, I would actually, you see I have the link there for the YouTube video of it. But what happened is that Margret's mother was brought to the hospital. She gets a phone call saying, come to the hospital. Her mother's been brought to the hospital. The doctor decides that she had pneumonia. She was not dying. She was not nearing death. It's not like she was a person who had late-stage cancer and it's a matter of days and, oh, the doctor made a decision just to hurry it up, per se, as they might say. No, in this case, she had pneumonia. And the doctor decided that, well, because, you know, Margret's mother didn't want to go to the hospital, and she was, you know, not wanting to go out, and she was, you know, in these situations, that maybe the best thing was to inject her. No one had requested it. Her mother had not requested it. The family had not requested it. So what happened is as she was going to the hospital, she gets a phone call, because she's the power of attorney, she's the person to make decisions for her mother. She gets the phone call from the physician in the hospital saying, oh, you don't have to hurry, because we've given her something. And she's not going to wake up from this. And you would say, well, how could this happen? How could this happen? Well, I thought it was all about freedom of choice and autonomy. I thought that's what it was about. Is this really what it's about? Remember, the doctor then says to her, when she says, well, how could you do this? Who would make such a decision? How would and she had her daughter with her, and she's asking the doctor this. The doctor says, well, you weren't here to decide. So we had to make a decision. So I made the decision. And this was his response. What about Candace Lewis? Now, this is a Canadian case, and many of you have heard about Candace Lewis because she was in the media. We've certainly talked about Candace Lewis. She was featured in Fatal Flaws. Candace is at the time 25, so this is shortly after euthanasia became legal in Canada. This was in August of 2016. She was born with multiple disabilities. She's in the hospital. She's having serious health difficulties, and the doctor is pressuring the family and Candace to ask for euthanasia. The doctor's saying, did you know that assisted death has been legal? Assisted suicide death is legal. And Candace's mom is saying, I didn't know that. And he's saying, well, I'm supportive of this. And she's like, well, you know, that's your point of view. That's your business. We don't want anything to do with this. And he's pressuring her. It's all about pressuring her to, quote, quote, choose an assisted death. Really what it was about is, here you have a physician who sees a woman with multiple disabilities who's clearly going through a difficult health situation. No one's questioning that she wasn't going through a very difficult situation. There's no question about that. He's viewing her life as not worth living. He's viewing her life as, this is a good case for euthanasia, and I guess they haven't heard about it yet, so I'm going to share this new information so they can ask for this. Well, this is what it's about. And I want you to know, we've gotten several calls like this from other people who may not want their stories being told in a wider sense, where they're being pressured. But not only people like Candace, which is bad that they were pressuring Candace, her family, in this whole situation for euthanasia, but what about the doctors who are now being pressured by others now to do it? This is also the other effect that's going on. The pressuring. Is it about choice? Is it about terminal illness? They say it's about terminal illness. Well, if it's about terminal illness, then Jeanette Hall would have been dead 20 years ago. Jeanette Hall, now the slide says 18 years ago. It's actually 19 years ago now. Jeanette Hall is in Oregon. She went to Dr. Stevens. She had cancer. She wanted the pills, okay? She wanted assisted suicide. This is what she wanted. She had a treatable condition, but her aunt had died with cancer. It was her aunt had lost her hair. Her aunt went through some difficult symptoms. Her reaction was, I want the pills. Jeanette had voted in favor of assisted suicide. It was legalized in Oregon through a plebiscite, through a voter initiative, right? And she wanted assisted suicide. But Dr. Stevens, he didn't believe in assisted suicide, but he also did what a good physician would do. He spoke to her. He found out about Jeanette Hall. What was important about Jeanette Hall was she had a son. This is very important to Jeanette. She had a son, and her son was at the time in the school to become a police officer, right? So he's an officer. He's becoming a police officer. So he says, so Dr. Stevens, and finding out how important her son is to her, and finding out what her condition was, and she was saying she didn't want treatment, she wanted the pills, and he said, you know, if you accept treatment, I guarantee you'll be at your son's graduation. And it made her think. It made her think that I have something worth living for. She felt she had nothing to live for. She felt she had lost hope. She was afraid. These are all normal human realities. Dr. Stevens wasn't saying to her, I guarantee you, Jeanette, you will live for 19 years. He was saying to her, well, if you accept treatment and not assisted suicide, you can then see your son graduate. And it made her think. So if you're watching Fatal Flaws, you'll see then Dr. Stevens saying in the film, well, then I was in dinner 5 years later after Jeanette she actually was cured. She got better. This is a good thing. That doesn't mean everyone will be cured and everyone will get better, but it does mean. So 5 years later, he's having dinner with his wife at a restaurant, and who's there? Jeanette Hall. And Jeanette came up and said, you know, Dr. Stevens, if I had had a different doctor, I would be dead now. And that's the whole key to this. The law is designed to give the power to the physician. So we're talking about my body, my choice. It's the only thing I do in the law, whether it be Canada, Oregon, assisted suicide in other states, or in the Netherlands with euthanasia, the only thing I do is I ask for it. And they say, well, asking for it. There's many reasons I might feel my life has lost its purpose and value and feel that the best thing for me is death. There's many reasons I might be very down. That's a normal reality. Okay? The difference is the physician then assesses me. The physician decides. The power's in the hands of the physician to decide whether or not my life is worth living. And that's how the law actually works. Is it about terminal illness? There's lots of cases actually, because you can consider Canada. Many people watch this in the future, obviously, because EPC being here, would be thinking of the Canadian situation. And I mentioned about how the law was wide enough to drive a hearse through it. The Canadian law says that you have to be terminally ill, but then it defines that as, my natural death must be reasonably foreseeable. I don't know, what does that mean? What does it mean that your natural death must be reasonably foreseeable? We had a case of someone who contacted us a couple years ago, and this man had asked for euthanasia, and his wife was opposed. So this is how we got the call from his wife. And he had MS. He was 51 years old. He was fairly debilitated by his MS. That's true. He needed a lot of care. So he needed a high level of care. But he wasn't dying. The doctor who had approved the euthanasia and ended up killing him by the lethal injection, the doctor said the reason she approved him for euthanasia was that she said, well, because he had MS and he was in a bed all the time, he could easily develop a bed sore at any time, which means his natural death was reasonably foreseeable. Well, you see, that's so wide. You know, the interpretation is so wide of this that, in fact, the law, well, I have to watch my language. These laws have effective safeguards, it says. What's effective safeguards? Well, in all jurisdictions, these laws are designed to give the doctor who's willing to kill his or her patients the power and oversight of the law. The system of oversight is a self-reporting system. And they did that on purpose to protect the physician completely. The law, whether it be Canada, Oregon, or the Netherlands, is all a self-reporting system. So the system is designed to cover up any potential of abuse, to ensure that the physician has no fear of reprisal. So for instance, whether it be Canada, the Netherlands, or Oregon, how it works is a physician, or in Canada, nurse practitioners can also do this. They would then meet with the patient, assess the patient, decide whether that patient fits the criteria. But you see, it's very open to interpretation. But what makes it even worse is there's no third-party intervention. This means someone who's totally outside of it, who only does assessments, who is responsible only to the government. There's nothing like that. How it works is a second physician that approves what the first physician has said. Most jurisdictions, the second physician never has to even meet the patient. They're only doing an assessment as to whether the first physician seems reasonable in what they've decided. And as I said, in Canada, it's also nurse practitioners. And then after the person has died, it's the physician who approved the death, who causes the death, who sends in the report. And then they say, oh, well, this is oversight. We have a report gathering system. Well, later on with the presentations from Amy and Taylor, you'll find out a little bit about these reports, especially the Quebec report. Gives us a little bit more information about how the oversight is actually working. The fact of it is that the system is designed to protect the physician. It's not designed to protect someone who has lost hope and is seeking death for whatever reason. These laws also apply to people with psychiatric conditions. Now that's Canada, it applies to psychiatric conditions. In places like Oregon, and it also does, because in fact very few assessments are done. The law requires an assessment in the state of Oregon for assisted suicide, and very few assessments are ever done. In California even, they've gone even further and said that you can't deny assisted suicide to someone in a psychiatric institution. When in Canada it says physical or psychological suffering. Now it also says that your natural death must be reasonably foreseeable. But I'm assuming that someone who has attempted suicide on multiple occasions would then qualify for euthanasia in Canada, or could be interpreted that way, based on the fact that their natural death is reasonably foreseeable. Do people die by euthanasia without request? Well, you see, we don't have a lot of Canadian data, but we do have data out of Belgium and the Netherlands. And the most recent data out of Belgium shows us, and there was a study that came out showing us that in 2015, sorry, that's the Netherlands study. In 2015 in the Netherlands, there was 431 euthanasia deaths without request. And that's so the Netherlands does what you call these meta studies, where they're looking at a huge number of deaths, and they interview then the physicians, and then they're gaining data on this huge number of deaths, and then they can extrapolate from that data how many deaths are occurring without request. And these are done as blind studies, so therefore what's happening is the physician who's being questioned knows that what he's saying in the questionnaire is not going to get him or her in trouble with the law if there's something that's quite serious. Okay? And in the Netherlands and Belgium, the 2013 study, which is the most recent one we had, showed that there was 1,000 euthanasia deaths without request. This is huge. Now, does this happen in Canada? I have no idea if this is happening in Canada to whatever degree, because we haven't done any serious study. But the fact of it is we're talking about human nature again. And so if someone's life is seen as not worth living by a physician, if somebody is, let's say someone's incompetent, and the family is pressuring the physician, could this possibly be happening at times? Well, it'd be nice to know, but I'm assuming that if it happens that often in the Netherlands and Belgium, it must be happening here. The laws are also based on personal suffering. Well, my friends, there's lots of interpretation around personal suffering. And it's not that I don't have feelings for people experiencing personal suffering. I just recognize the reality that this is totally open to interpretation. The Fatal Flaws film features serious stories. Now, what I'm doing is I'm talking about this because many people are going to say, how do I spread the message on euthanasia and assisted suicide? How do I talk to people about it? How do we make this possible? Well, you can order a couple of the pamphlets and things from the Euthanasia Prevention Coalition. You can bring in a speaker. But the easiest way to do it is simply to purchase the Fatal Flaws film, or the previous one, the Euthanasia Deception, and show it in your community. And sometimes 50 or 100 people come out, and sometimes 10 or 20 people come out. But the point of it is it's the easiest way to organize an event to bring people out and actually talk about the issue, because you're actually then showing these stories in an effective manner. And that's what we've been promoting. An elderly woman with pneumonia died by euthanasia without request in the Netherlands. These are real stories. There was another story that's not in the film, which is very powerful, of and actually it was mentioned in the film, of the woman in the Netherlands who had dementia. She had dementia, and she had previously requested euthanasia, but now she's incompetent. So when the family and the doctor decided to go ahead with the death, the woman is saying no. She's saying no. And now this case is right now in the courts, because what ended up happening is the woman resisted, saying no, no, no. She didn't want it. Okay, she didn't want to die. Now, she had previously requested it, but there's many reasons you might fear for your future and put into some document, yeah, if I had this condition, I would rather be dead. That doesn't mean when you're in that condition, you would actually rather be dead. It just meant that when you were asked, 10 years earlier or 5 years earlier, that's how you felt about the situation. So what happened is the physician put the sedative in her coffee and thought, well, if we sedate her first, then it's going to be easy to kill her. Then what happened is that when he goes to inject her, she's still resisting. So I guess there wasn't enough sedative in the coffee. Nonetheless, she then asks, it was a female physician in this case, she then asks the family to hold her down as the injection's done. Well, let me tell you, is this all about choice and autonomy? There's the link. You can find out more about the fatal flaws. And we can put that up again later. It's a very important thing. This has been, so just so you know, we've sold thousands of this film already. You can actually download it. You can buy it from the Euthanasia Prevention Coalition. The idea is to show it. The main media, just so you know, when we produced the Fatal Flaws film with DunnMedia, we tried very hard to get some of the major media outlets to decide to show it or show a piece of it or to come to an agreement with them on something like this, and none of them bit. Like, there was serious work done into this. You're saying, what are we doing to try and get the message out to the main, part of the culture? They turned us down. If you consider in Canada, CBC, the Canadian Broadcasting Corporation, has shown several major films promoting euthanasia in like an outright way, promoting euthanasia, yet they wouldn't even take a piece of the fatal flaws. I don't know. Like, to me, that's not exactly what you call even production value or even promotion. So the way we have to do it is we have to get the message out ourselves. Here's our contact information, and for those who are going to be watching it later, you can email me also anytime, as you see at info@epcc.ca. And I don't know if I have any questions that have come to me by email. I did send it out. You could say, oh, someone did send me a thing. Oh, that's fine. No question there. So what we're going to do is thank you very much, and I'm going to then switch over to Amy, and Amy's going to introduce her topic to you. And I notice we have a few things here we can make it easier for you guys.